Welcome to Disability Clinic, where we break down how Breaking Bad breaks back, as in spinal cord injury, as in when someone gets paralyzed. You get it. After someone sustains a serious injury to their spinal cord, how does that person and their family navigate their hospital bills, their insurance coverage, their recovery, and the rest of their lives? Where do they even start? It can be really daunting, scary, and frustrating. And our healthcare system should be helping people navigate these challenges, not creating more challenges. Today, my colleagues Hobal and Robyn are back. Back. To watch a scene from Breaking Bad that shows Hank's family struggling with planning for and paying for his recovery and rehabilitation. The show's version is very different from what actually happens in real life. I think Robyn's initial reaction sums up our feelings nicely.
So I was cringing the first time I watched it, and I cringed this time as well.
So to set the scene, Hank was shot 4 times during an assassination attempt. He has a new disability, and his family are trying to figure out what the next steps are. But they get very little guidance or support from Hank's healthcare team. Let's break it down.
Marie, it's important that we manage our expectations. We're talking about months of very hard work, and even then the odds, they're not great.
Okay, so no doctor should be talking to a patient's family member like this. He's so passive and indifferent. The odds, they're not great. He is correct in saying we need to manage our expectations, but it's more accurate to say it's too early to tell how much functional recovery Hank can potentially achieve. It's much more reassuring to say that the care team is doing everything they can to support Hank throughout his recovery. Hank is working hard, hopefully, and if he continues to progress, he'll likely be able to do all the things he needs to do for himself on his own, because that's actually true.
But you can't know for sure.
No.
When does he start physical therapy?
First of all, I thought it was odd that the patient wasn't present.
That's really unrealistic because I was part of those conversations. I'm an adult. I can make my own decisions, and it's like they're making the decision for him. That's not right. So that was the thing that struck me the most. It's like, where's Hank? He's supposed to be participating in this. It's like a family conference.
We've sent the paperwork to your insurance. It's high priority. We should have pre-authorization in the next few days, certainly by early next week.
So I was really shocked that they were still waiting for authorization, even if they were in the acute setting.
Yeah, and spinal cord injury is one of the slam dunk, you absolutely qualify for acute
right.
There's no question.
Exactly.
When you first get injured, at least I didn't know about rehab hospitals. I thought they were just regular hospitals and that's it. I didn't know that some rehab hospitals specialize more on certain things than others, like Rancho. It's really, really good at treating people with spinal cord injuries. Even people who have private insurance kind of fight their way to get into Rancho because it's such a great facility. So when I got hurt, I just looked for the hospital that was closest to my house so that my family could come and visit me, not knowing that I'd missed the opportunity of being in a better rehab hospital just for the fact that it was far from my house. So yeah, it's a lot of things that you're new to. You never plan on having a spinal cord injury and deciding what kind of hospitals you're going to go to. It's all happening very quickly and with a lot of emotions running wild.
Next week? No, that's not going to do it. I've looked into this, and the sooner physical therapy begins, the better his chances are. He needs daily sessions, isn't that right?
Well,
Actually, your plan's treatment program covers 4 sessions a week. Actually, she asked the doctor.
I really think that Hollywood, or just the portrayal of this situation in this show, is trying to just antagonize the whole process and make the characters really struggle. So I get that it's a sort of storytelling strategy, but I feel like they skip over all of acute inpatient rehab. It seems like Hank is still in the acute hospital and they're talking about 4 days a week of therapy, which is not enough.
Not enough, right? And unheard of. And there is a certain requirement for therapy, at least in California, with 3 hours of therapy 5 times a week at minimum,
Plan-wise, 4 treatments a week is fairly typical.
Wrong. Like Robyn was saying earlier, the standard of care after any significant injury is 3 hours of therapy a day divided amongst physical, occupational, and sometimes speech therapy for at least 5 days a week minimum. That's a lot of work. That's like a part-time job. This is what actually happens in acute inpatient rehabilitation. So Marie is correct. Hank needs and qualifies for daily sessions, and the sooner the better.
And the therapists in your network are mostly fine.
I was like, whoa, that's not a very good sign. I don't want to hear that. We're not talking about how I'm going to live for the rest of my life, how much I'm going to recover. I don't know. I doubt a doctor would say that about physical therapists he works with.
Mostly fine. Okay, well, there's a ringing endorsement. Look, if Hank had more physical therapy with better therapists, wouldn't it be more likely he would walk?
It's very hard to say, Marie.
It's actually easier than this doctor is making it sound. Regardless of the likelihood of Hank walking again, Hank has the best chance at functional recovery if he goes to an acute inpatient rehab hospital and gets daily therapies. Period. It's the standard of care, and if any healthcare professional tells you otherwise, they're probably a TV doctor.
Is the health plan's way medically justifiable? Sure. Is it absolutely optimal?
You know, screw it. I'm gonna make sure he gets what he needs and they can just reimburse me later.
Mrs. Schrader, I get your frustration, really, I do. But my best advice is stay in the network. Don't go out of pocket. Physical therapy is just the beginning. We're talking nursing care, modifications to your home, occupational therapy, medical equipment. It could run into the hundreds of thousands of dollars.
The show is making a very important point here. People who need healthcare in this country, that's everybody, are at the mercy of their insurance coverage. It can feel like you have no choice about the type or quality of care you receive because this depends largely on your insurance, your employment, and any out-of-pocket costs. It also very much depends on the time and energy you, your family members, and your healthcare team are willing to invest in helping you get the care you need. Healthcare is a business, and our social infrastructure is designed to prioritize profit over quality of care and access for all. But we're going to change that, one video at a time.
So what? We're just supposed to compromise on his care?
Well, if you don't follow the insurance company's procedures, they may never pay you back. I've seen patients and their families go bankrupt waiting to be reimbursed.
Yeah, it's a really stressful situation. I was worried a lot about what am I going to do next, and you don't know where you're going to go, and you're trying to look for places, and you don't know if they're going to be covered under your insurance, which is a big problem here in the U.S. that people are limited as far as the care they get depending on the type of insurance they have.
Who is the best physical therapist that you know?
I can give you some names, but they're not likely to be on your plan.
It's pretty unrealistic that patients and their families would have to shop around for physical therapists out of network at this stage after an injury like Hank's, because the majority of people in his situation would qualify for acute inpatient rehab.
Down with the plan.
It's a difficult thing because they're trying to make the best decisions because they love him and they want him to get better. But you kind of also have to balance like how much risk you're taking. Is it worth spending that much money for a therapy that might be good enough for him? It's tough. People make difficult decisions in those situations.
Do you hear from patients that you talk to that they experience a lot of financial strain? Like, have you heard of people like really not being able to afford the care they need?
Because we work in a county facility, their medical care is covered. Most of the financial concerns that they have are how am I going to pay my bills? How am I going to pay the mortgage for my house? How am I going to feed my kids? They're all like brand new to this. Nobody ever plans for something like this. So, and we kind of help them with resources about finances and how you can apply for SSI or an SSDI and state disability. And there are other programs that can help you. Just overall, having a disability is very expensive.
Yeah, and if you're not working, even just during your recovery period, that's a long time without income.
Households that include an adult living with a disability require an estimated 28% more annual income to achieve the same standard of living as households that don't include an adult living with a disability. That adds up to at least $20,000 more per year. And only a percentage of people with disabilities can work, and only a percentage of those people get hired or promoted. For more resources on the affordability of disability, check the link in the description below. So just how well does Breaking Bad's family conference reflect what actually happens in real life?
It looked like a very Hollywood production. I would be surprised to think that's a typical conference. The facility that I work at, for our conferences, we have the whole team. So the patient, the family member or the primary caregiver. We have the physician there, a representative from nursing, all representation from therapy. So if it's a speech therapist involved, physical therapist, occupational therapist. We also have the psychologist present, social work, case management, everyone that's involved in this person's plan of care is present.
Robyn is describing the basic multidisciplinary team you should be able to find at any acute inpatient rehab hospital. But it's not common enough in healthcare in general. So maybe it's a good thing that Hollywood is calling us out. The best strategies for supporting someone after an injury need to be more common throughout our healthcare system. Anyone who experiences a traumatic injury to their spinal cord or their brain should expect this standard of care.
You're not in like a waiting room, right?
Right. You're in an actual conference room, or in rare occasions in the patient's room with the door shut, and it's an opportunity for every individual that's part of the team to speak and share their insight versus an individual speaking on your behalf. Like in this case, it looked like the case manager was providing information regarding physical therapy or speaking on behalf of the physical therapist. And it would have been great for the PT to be able to interject and provide the insight.
A lot of frustration and misunderstanding is avoided when there's good communication between patients, family members, and the whole healthcare team. Family conferences happen multiple times throughout the course of someone's recovery in inpatient rehab. And the rehab team meets formally at least once a week to discuss someone's progress and to troubleshoot any barriers to that progress. Injuries are traumatizing, new disabilities are challenging to adjust to, and the healthcare team should be an important source of support and guidance for patients and their families. Let's see how Hank's wife reacts when she's clearly not getting good support or guidance.
I swear to God, I'll do it. I will go to the press. I will go to 48 Hours. I will go to Nightline. I don't know if there is a Nightline anymore. It doesn't matter. They will all take it and they will run with it.
You can tell how desperate he is for him to get the best possible medical care that he can get. I can't imagine how that situation must have been, getting shot multiple times during assassination attempt on your life, like they were specifically going for you. Oh, it's tough. If I were in her shoes, I would do anything I could.
I get that desperation, but that at the same time, Hank's alive, right? Like he survived. I think she's even in more distress, not just because his life was threatened, but now that he's alive, she still feels that it's not enough and that walking is still the sort of the definition of wellness. And, understandably, I feel like most people have that perception. It's ableist, sure. And it's sort of a normal part of adjustment. But I also feel like she could use some more perspective on how lucky Hank is and like how there are many things that he'll still be able to do.
Because he is a hero and he is not going to be in a wheelchair at 43.
He's not going to be a wheelchair at 43. I'm like, I was in a wheelchair at 24. What's wrong with that? But on those shows, they just focus so much on walking, and it's kind of like their journey from having an injury to walking again. So they just like, that's the fantasy. And I guess that's what most people think at the beginning when they don't understand about disability and how living with a disability can be fine. Like you can have a successful, complete, really fulfilling life despite your disability. So they're just focusing on walking, which I guess it's the normal thing TV does.
Thank you to Vince Gilligan for giving us the opportunity to talk about multidisciplinary team conferences, how they're supposed to run, insurance coverage, and how we help people and their families every day at work. If you learned something new from this video, consider giving it a like and sharing it with like-minded people. If you're as frustrated with our healthcare system as I am, consider subscribing to Disability Clinic, where we specialize in adapting to adversity. Thanks for watching. Family conferences. I don't know what to do with these anymore.